Good morning, ladies and gentlemen. I am today's presenter on the topic of Eczedone, all natural eczema relief. Before we get into Eczedone, I'm going to go into a brief overview of what eczema actually is, and then talk about alternative remedies for eczema relief, and then go into Eczedone and its effectiveness and clinical trial. So I'm going to start off with a quote that I feel really stuck with me, ironically in reference to eczema. Life is a series of natural and spontaneous changes. Don't resist them. That only creates sorrow. Let reality be reality. Let things flow naturally forward in whatever they like. The reason this stuck with me was because eczema currently has no known cure and can lay dormant for several years and then spontaneously reoccur. And so it's random and unpredictable to the patient in how their symptoms are exacerbated and how they can be prevented. So moving forward, what is eczema? Eczema is a chronic inflammatory skin disease that results in red, itchy patches on the skin along with cracks and oozing. It's when our immune system overreacts. And delving deeper into what our immune system does in reference to inflammation. Inflammation is the immune system's normal response to infection or injury, and it protects us from diseases, viruses, cuts, and sprains in the form of physical manifestations such as redness, swelling, heat, and pain. Now, patients with eczema have a genetic tendency to have compromised skin function. They're missing this little protein that allows skin to hold and retain water, which therein makes the skin vulnerable to allergy-like reactions, irritations, and causing further infection. Now, along with genetic factors, there's also environmental factors that are taken into account that exacerbate the symptoms of eczema, which include things that are unpredictable in your environment, such as metals, foods, the fabrics you wear, perfumes that are maybe around you, or chemical additives. 35 million Americans are affected with eczema to date, and that number has doubled in the last decade. So eczema is on the rise, and we're doing the very best we can to minimize its scope. Symptoms of eczema include, but are not limited to, dry, sensitive skin, intense itching, red, inflamed skin, scaly areas, dark-colored patches of skin, areas of swelling, oozing or crusting, rough, leathery patches, and recurring rashes, to name a few. Going into the alternative remedies of eczema. So a lot of these have had extensive research done on them and have proven to somewhat relieve the symptoms of eczema, but with compromising adverse side effects in the process. So topical steroids are a huge relief from eczema that's been prominently out there in the market. However, it is a short-term care. It only relieves the symptoms of eczema as you continuously either inject or orally intake these topical steroids. Once you stop taking them, the relapse has shown to be more intense symptoms of eczema, leading to further use of the steroids, which then lead to the side effects such as skin thinning, stretch marks, high blood pressure, hair loss, gastrointestinal issues, and stretch marks, and even acne. Moving on to immunosuppressants. So as we talked about earlier, what the inflammation does is that it stays essentially on. It constantly is feeding the body this redness, the swelling, even in parts of the body that don't have diseases or viruses. So constantly adding to the dry, sensitive skin and the inflamed areas. So what the immunosuppressants do is they attempt to slow down the symptoms of eczema or psoriasis or dry skin by suppressing the immune system, which in theory is a great viable option. However, in reality, what that leads to is with your immune system defenses weakened, you're allowing yourself to be prone to more infections such as different kidney damage, liver damage, and other infections, and even cancers, along with the side effect of these immunosuppressants providing upset stomach and vomiting to patients. One of the other more effective forms of remedy to eczema has been phototherapy. So phototherapy is ultraviolet light therapy using narrowband and broadband UVA, UVB lights to reduce itch, calm inflammation, increase vitamin D production, and ramp up bacteria fighting systems in the skin. While this is all very good and effective for eczema, it does come with its side effects, which are included but not limited to sunburn, skin aging, melanoma, headaches, nausea, and cataracts caused by intense exposure to long periods of light. Other general over-the-counter remedies that have been proven effective to some degree and extent with certain subjects has been hydrocortisone, cold tar, which is known to soothe the skin, along with other shampoos and moisturizers, and another one being wet wrap therapy, which has shown to have very soothing relief for eczema. However, it's very time consuming and not cost effective in any way, leading to why Eczedone? Why should we use Eczedone over all these other alternative remedies that I've just listed? So to begin with, Eczedone is clinically tested. It's on an FDA monograph for the treatment of eczema, which, unlike topical steroids, which are highly recommended to be on for as little as a time as possible, you can bathe in Eczedone soap for the rest of your life and have nothing but naturally positive results, considering it's all natural ingredients that you're very well familiar with yourself, including coconut oil, cocoa butter, colloidal oatmeal, and olive oil. These are the four ingredients that make up the soap. It's super hypoallergenic, so taking into account that symptoms of eczema are exacerbated by external factors such as clothing, fragrances, and other external, environmental factors. Knowing that it's hypoallergenic is definitely a plus, along with the fact that it was invented for all ages. It was invented for an infant by an inventor by the name of Jeremiah Perkins, who came up with this soap to remedy his son's eczema. He's been an inventor his whole life. He's been surrounded by family members who, growing up, used to create their own soap. As it came down to figuring out an alternative for relief of eczema for his son, he tried all the options out there that have been shown effective to no avail. With that, he got into his own warehouse and started making different trials of his own soap. He learned the molecular science behind soap and what it would take to essentially form the most effective eczema relief out there. And that's how he came up with Eczedone. So it's effective for infants, but also full adults. Moving on into the trial of eczema. So we did a clinical trial on the effect of Eczedone. It was an adaptive, double-blind, randomized, vehicle-controlled clinical trial on the effect of Eczedone as a treatment for atopic eczema. So it involved several patients that had been diagnosed with eczema in the past, and they were given a subjective scoring analysis test based on POEM, which is the patient-oriented eczema measure, and the TIS, which is the 3-item severity score. The POEM measures disturbed sleep, itching, skin bleeding, cracked skin, skin flaking, rough and dry skin, whereas the 3-item severity scores tests on the quality of life, the severity of itching, and eczema severity, with subtext being excoriation, erythema, and edema. Now, what the test found was that, as you can see here in the first top subject, starting at day 0, you see rough, dry skin, you see dark pigmented spots, all that have mostly been cleared away by day 14 only in this patient. Now, what we found was that 93% efficacy in all patients that were tested with the soap over a simple 2-week period. So highly effective, highly rapid results, and of course, no side effects reducing itch, increasing moisture, calming inflammation, and allowing the patient to not have any adverse side effects along with that. So 93% efficacy on this clinical trial. We look forward to gaining traction in the market for Eczedone, as it's proven effectively anecdotally. So one of the major neurosurgeons here, Dr. Shah, himself has anecdotal evidence based on the fact that his daughter for the past 6 years has been using this soap and shows zero to little signs of eczema. We have several inside employees that use it for their children and have shown highly positive results and continue to do so. We have a doctor who's just recently ordered this eczema soap and is going to do an in-depth systematic trial on his daughter who suffers from eczema, diagnosed with. So we have a lot of great stuff going on, and I'll leave that to the floor for questions. Yeah.
What was the age range on clinical trial?
So it was designed for an infant, so it's not tear-free, but it's baby safe, designed for babies, but it's powerful enough to be effective for adults as well.
How often do you have to use it?
So it's recommended twice a day, but at least once a day. You want to bathe with the soap as you normally would, being very gentle with your skin, but lathering it for at least 20 to 30 seconds on the affected areas, once or twice a day, and then, if need be, applying a moisturizer after. Thank you very much for your time.